Everyone, welcome to researchmd.com. Today we got another topic today, enhanced external counterpulsation, which is like EECP. And again, my name is Pramil, Cheriyath, the Program Director, Internal Medicine Residency, Transitional Residency, and I teach medical students and residents on a regular basis. So let's look at what is enhanced external counterpulsation. Okay, it has been approved by FDA, it's approved by Medicare for reimbursement, even private insurance are able to pay for reimbursement for that. So it uses pressure in the lower limbs to improve the blood flow in people with a long-term symptoms of heart disease, such as chest pain and chest pressure, if they have like CHF. And mainly in the United States, they use that for the people like chronic angina. They have tried everything else and not benefit. That's what the United States currently like recommended for. So let's look at the technique. I mean, we have like, it's a non-invasive, that's the word to remember. An outpatient basis you can do. Treatment is given over 7 weeks, and you got multiple sessions, and it's administered through like 3 pairs of external inflatable cups. We got like nice picture over here. They put it around the lower leg, upper leg, and near the buttock region. So the 3 places they put. And what do? They continuously inflate and deflate between the resting period of the heartbeat. So they kind of synchronize with the heartbeat, and they propel like blood back in the early diastole, because in diastole, like that's where the patient, get like more blood supply and all that. That increase the blood return to the heart by improving the blood flow. Okay, so let's look at the mechanism of action. And there is a raised transmyocardial pressure gradient, which open the latent conduit. And the main thing is also, studies have shown there is arteriogenesis or angiogenesis. There's like collateral circulation. I don't think anything else or any other drug or any other studies have shown like, angiogenesis in these people. Nitric oxide, we all know like what happened in the nitric oxide, like vasodilation, very beneficial, right? And restore the flow reserve, also postulated. And then mechanism, then you have 35-hour long periods of cardiac assist, rest the myocardium. Myocyte metabolism switches back from free fatty acid energy supply toward glucose utilization. Then you got neurohormonal signals are normalized, permitting improved arterial compliance and arterial reactivity. And the oxygen demand is reduced as oxygen deficiency is improved. These are the main mechanisms. So what are the benefits in a nutshell? Increase oxygen supply to the heart, decrease the chest pain, improved EKG response to exercise, decrease the nitroglycerin the patient has to use, increase in energy, increase exercise duration, and the long-term effects. Studies have shown, like some studies like 3 to 5 years, the effects kind of less. If you look at it, there's decreased endothelin, is decrease of BNP, increased nitric oxide, increased VEGF. That, what does it do? Is it promote angiogenesis? Like one of the benefit is like it produces collateral circulation, okay? So condition treatment, mainly like refractory angina, that's like the common, but can be used for other cardiac syndromes, cerebrovascular disease, mainly like heart failure also, kidney failure, left ventricular dysfunction, pulmonary disease, and the peripheral arterial disease also. Now, so mainly the eligibility, like long-term chest pain, they tried everything else now working. Refractory is the word we usually get. No relief with the medication. Don't qualify for any surgery. And relapsal symptoms are invasive procedures such as bypass surgery, angioplasty, and you have like many stent and done and still no symptom relief. Contraindication, then you have like, let's say you have hypertrophic cardiomyopathy is contraindicated, congenital heart disease, valvular heart disease, enlarged heart pacemaker, atrial fibrillation, pulmonary hypertension, and peripheral arterial disease. Also, we make sure like when the patient is of high blood pressure, they should stay away from that, okay? So this is a study, multi-center study, looked at the EECP and the effect on the exercise-induced myocardial ischemia. Let's see what they find the results are. So enhanced EECP kind of reduces anginal symptoms and extend time to exercise-induced ischemia in patients with the symptomatic coronary artery disease. So this study clearly shown like time to 1 millimeter ST segment depression increased significantly from the baseline after in active chest pain compared to the inactive. Okay, so very clearly shown based on this study some benefit. These are the references. Thank you so much for watching. We'll be back with another presentation soon. Please subscribe to our channel.